Hello friend, this is Dr. Priyanka. Today in this video, we are going to listen about how to initiate a pediatric case taking. Specifically, if a homeopath is watching this video, so how to initiate a case taking in a pediatric child. Means pediatric group, what should be the questions needed to be asked by the physician in order to take a proper case history, come to a proper totality of symptoms and form a constitutional remedy and treat the patient. So let's begin to the topic. So pediatric history taking begins with building a rapport with both the child and the parent or caregiver. So the important thing is establishing a trust and open conversation with them.
So friends, let's listen about the nomenclature. That is, neonate is less than 28 days, infant who is between 1 to 12 months, toddler who is between 1 to 3 years old, preschooler who is between 3 to 5 years, school age which is 5 to 12 years, and adolescent age which is 13 to 17 years.
So the important thing is create a comfortable environment, especially for the child, also for the parents. Have a proper gesture to invite them in your OPD, use age appropriate language and engage in active listening to put the family and the child at the ease. So friends, basically when we are proceeding for the pediatric case taking, the following questions are very important as a database also and for your proper communication with the patient. So the first comes is obviously the full name of the patient, then the date of birth, date of visiting to your clinic, permanent address, age and sex, contact number, whether of mother or father or both. So this basic information can be taken by your receptionist itself, but after entering into your cabin, you need to ask them properly. Because how I work in my OPD, I maintain a digital medical record where I do the entry of all the patients in my laptop. So we have one register and one digital record. So when the patient comes to us in the OPD, first they go to the receptionist, they search their name, they look for the date of visit to the clinic and when the follow-up was advised, and then also the second checking happens inside the cabins. So because of this habit, we can maintain a proper medical record of the patient. So then comes a preliminary information. In the preliminary information, attending physician, that is who is attending the case, write the name of the physician, homeopathic consultant, then language at home, that is language of child at home, diet, father's details, and that you have to ask name, age, education and income if they are comfortable to share. In mother details also you have to ask name, age, education and occupation, history of any consanguinity in parents, brothers, that is how many siblings are there to the child, total number of family members, total earning members in family. Then comes the present history. So in present history, you have to note all the chief complaints narrated by the child or their parents. Along with that, you have to mention since how many days these complaints are, when it started. Then comes birth history. So mother's age at the time of conception, father's age at the time of conception. So pertaining to the mother, following details should be asked, that is gravida, parity, abortion and living. Many of the time when patient visits to us, there are the complaints like autism or hyperactivity. Since very long, this has been introduced in the homeopathy because we prescribe on the mental symptoms too. So attitude towards pregnancy of the mother is very important. Whether she was happy during the time of conception when she heard the news about that she is pregnant, or she is unhappy, or there is something fear. Ask the proper detailed history which will help us to differentiate the remedies which will come to the end after forming a totality. Then type of pregnancy, means whether it was planned, whether it was unplanned. Then comes health during pregnancy. How was the health of the mother, where she was eating properly, proper vitamins was been taken, any illness during pregnancy, any diseases, any treatment taken. Mention all the things. Emotional stress during pregnancy and family situation. Why this is important? Because whenever any stress factor comes, body rises up the cortisol levels. So this can harm the developing fetus. So whether there is symptom to the child, this history will help us to get to the remedy. Place and type of delivery, whether it is LSES, forceps, vaginal delivery. Then comes details pertaining to the child. So the primary comes as birth weight. So the normal birth weight is 2.5 kg. Birth cry, that is did child cry immediately after birth or didn't cry immediately after birth. Immediate postnatal problems, if any, kindly mention them. Any congenital defects like cleft palate, neural tube defects, spina bifida, Down syndrome, polydactyly, VSD, ASD. Then comes developmental history. In that you have to ask motor milestones. So first comes like whether he follows the light, whether head rolling was at proper age, rolling over was at proper age, grasping of objects, yes or no. See, whatever I'm asking the questions, you have to mention whether it is yes or no, because we are forming a picture of a normal healthy child. So if there is something abnormality, that will be the crucial information. Sitting without support, so that also you have to put it yes or no. Crawling, teething, standing without support, mention the year also when he started to stand without support. Walking without support, speech, vocalization, babbling, monosyllables like da, ma, ka, first meaningful words, full sentences, bladder control, bowel control. So this all are the milestones which we need to ask. Many of the times when we are treating any ADHD or autism patient, this history is very important, which is pertaining to the disease itself, which can guide us whether the milestones are delayed, where the milestones are on time, where it were regressed. So all the details we need to take. Then mental milestones. First comes that recognition of mother. When the child recognized a mother. Social smile, following persons or objects, responding to the name. Language comprehension, means the pronunciation. Looks towards the object or person asked for. Whether I'm asking where is your father, where is your mother, the child can point at them or he can look at them. Understands denial by interruption of action, means when the child comes and touches to a toy, and if I say them no, you keep it, so he understands that and he keeps the toy over there. So finally at the last you have to mention milestones, which is delayed or not delayed or regressed. Then comes history of immunization, any marked aggravation or side effects after immunization. Then comes past illness. So here we have to elaborate duration, intensity and consequences of the illness. So the first comes illness. What illness was? For example, neonatal asphyxia. So this we have to mention. Age of onset, when it was, duration, for how many days it was, and intensity, whether it was mild, moderate or severe. Course and complications, means whether the child was admitted, whether antibiotics were taken, what treatment was taken, and any complication happened after that. Then comes family history. So history of grandparents. So in family history, ask how many members are in the family. History of grandparents' health, whether they are alive, whether they are dead, what was the reason. Basically from the family history we are focusing on the miasmatic background of the child. Then comes school history, name and address of the school, in which standard he is studying and how is in his school. Then comes patient as a person. So diet details, in that vegetarian and non-vegetarian. Thirst, general appearance of the child, perspiration, sleep. In sleep you have to ask duration of the sleep, dreams. Then comes thermal state, whether hot, chilly or ambithermal. Important while taking thermals, you have to ask in every season whether the child takes covering, which water he prefers for taking a bath, and about the fanning. So with these details we are able to come to a proper thermal history of the child. Then comes mental space. So since the childhood, since the birth, you have to take all the details of the child, ask to the mother, ask to the father, talk with the child and take his current present symptoms in the acute disease or in the chronic disease, what it is presenting. So then comes sensory pattern. So in sensory pattern, so one more thing is like sensory pattern. This is included when you have cases like autism or ADHD or hyperactivity. When you are treating those cases, we have to ask a sensory pattern, in which we'll ask noise, whether the child closes ears during the noise, what is the response to the noise, how much intensity of the noise is disturbing the patient or exciting the patient, emotions, sentiments, love, hate, intensity of expression of the feelings. All these details are to be included in that section. Then comes physical examination. So in physical examination, you have to observe a pallor by looking the bulbar conjunctiva, gait of the child, ask the child to walk, all the vitals, that is temperature, pulse, saturation, respiratory rate. Then systemic examination, that is respiratory examination, cardiovascular examination, per abdominal examination, and CNS examination. All this proper examination should be included in the physical examination. Then comes the provisional diagnosis of the symptom with the chief complaints of the patient. You will come to a probable diagnosis, and then comes the final diagnosis. So along with that, friends, if you are advising some test, include those tests Then we have to do analysis and evaluation of the case. Then comes the totality of symptoms, then rubrics, then final rubrics, and then the final prescription with reason. Along with that, you have to mention the follow-up also and give a proper medicinal details to the patient. If you are prescribing in the bottle in the pill forms, ask your receptionist to mention the details when to take after the food, before the food, and explain them to the parents properly with the follow-up date when the patient need to come and your consulting fees. So I hope this case history and the proper pro forma to be followed during the pediatric case taking, which is needed by every homeopathic doctor to follow. So I hope this have helped you. If any queries, if any suggestions you need to give me, kindly comment below and let me know. So thank you. Stay tuned. Be happy. Bye bye.